Welcome to Red Tech channel, a new way to learn.
So today I am going to discuss about the MCQ video 11. In this video I will discuss about the 10 MCQ on radiography. Please watch the previous 10 MCQ video also. Before watching this, the link is given in the description. So let's begin. Question number 1. What type of electromagnetic radiation is used in radiography? So in radiography, what type of electromagnetic radiation is used? We have to tell about that all. Option are option A X-rays, option B infrared, option C gamma rays, and option D ultraviolet rays. So in electromagnetic radiation there are many rays. So answer is option number A, means X-rays. X-ray is a type of electromagnetic radiation which is used in the radiography, as we know that. Question number 2. Who is credited with discovery of X-ray? Means who is responsible for the discovery of X-ray? So option are option A Marie Curie, option B Wilhelm Röntgen, option C Thomas Edison, option D Albert Einstein. So these are the easy to moderate level. I hope you understand. So answer is option number B, Wilhelm Röntgen. Basically credit for the discovery of X-ray, you know very well. Question number 3. Which of the following is not a type of X-ray machine? So in the given options we have to tell about the which type has no consider in X-ray machine. So option A is diagnostic X-ray machine, option B fluoroscopy machine, option C CT scanner, and option D MRI machine. So in this given options, at what machine the X-rays are not used? So the right answer is basically option number D, which is MRI machine. MRI machine consists of magnet which has no use of X-rays. Now question number 4. What is the primary purpose of radiographic image receptor? So we have a radiographic image receptor in our X-ray room. So what is main purpose of that equipment? So options are option A to generate X-rays, option B to emit radiation, option C to record the X-ray image, and option D to enhance the contrast of the X-ray image. So as we know that radiographic image receptor is to use to record the X-ray image. So option C is the right answer. Radiographic image receptor is used to record the X-ray images, which is the main purpose. Now question number 5. Which type of X-ray projection is used to obtain an image of the long bone of the lower extremities? So in the lower extremities having long bones, where main projection is used to obtain image. So options are option A anterior posterior, means AP, option B oblique, option C lateral, option D posterior anterior, means PA. So in the long bone there is a AP view which we have to must go through, and there is another, that is basically in the long bone we have to cover one joint also. So the right answer is basically option number C, which is lateral. Lateral view is must in the long bone. I hope you clear out this point, the main basically projection. Now question number 6. The process of adjusting X-ray exposure factor to achieve optimal radiographic image quality is known as. So when we go through the X-ray, we have to maintain the optimal image quality by using some factor. So what will be that process called? So in the given option we have to tell about the process which is called. What is that? So options are option A collimation, option B radiolucency, option C radiographic contrast, and option D technique selection. So in the given option there is a option given collimation. Collimation means which decide the interest of area which is selected by the radiographer. And option number B radiolucency. Radiolucency consists means something object, and radiographic contrast means comparable. So option D is the right answer, which is technique selection. A radiographer is the person who decide or who adjust the exposure factor by achieving, or you can say to achieve, radiographic image quality. How it factor the by changing the KB and MAS. In the modern era, in the digital machine, there is no use of MAS and KVP changes. So to achieve optimal radiographic image quality, we have to consider this in the printing section. When we print the radiographer, when we print the radiograph, we have to maintain the brightness and blackness level, or you can say contrast and brightness level in the image. So this is the all over technical selection. Question number 7. What is the lead apron used for in radiography? So there is lead apron in the radiography. So what basically the use of lead apron? So option are: option A, to protect the patient's body from radiation exposure; option B, to protect the X-ray machine from damage; and option C, to protect the radiographer from radiation exposure; and option D, to enhance the X-ray image quality. So as we know that lead apron, in which consists of lead, which is used to restrict the X-ray image to pass through. So here the right answer is option number C, which is to protect the radiographer from radiation exposure. So primary basically usage is to protect the radiographer by the use of lead apron, wearing the lead apron. So this is the main usage. Question number 8. What is the purpose of using radiographic contrast media? So contrast media used in the radiographic image. So what is basically the purpose of that? So option are to reduce radiation doses; option B, to enhance visualization of certain structure or organs; and option C, to speed up the X-ray image acquisition process; and option D, to minimize patient discomfort during the procedure. So contrast media consists of some substances which is radio opaque. So to basically the right answer is option number B, which is to enhance the visualization of certain structure or organs. By injecting the contrast media in a vein, or you can say by swallowing, it differentiates the certain structure or organs and to give better visualization. Question number 9. What is the term used to describe an X-ray image that appears darker than normal? So if we have an image of the X-ray but it looks darker than normal, so what we called it in a medical term? So option A is radiograph, option B hyper radiolucent, option C radio opaque, and option D hyper radiolucent. So now if we go through the options, so radiograph means normal, so the option is incorrect, and radiolucent is the object which X-ray can pass through, radio opaque which can't. So right answer is here option number B, which is hyper radiolucent, means that is darker than normal. Question number 10. Which of the following is not a common radiographic positioning landmark? So in the given option there is one landmark which is not commonly usage, or you can say not common. So option are: option A, sternal notch; option B, acromion process; and option C, greater trochanter; and option D, external occipital protuberance. So here in the given first three options, these are the common radiographic position landmark which are using in the daily usage. You can easily get it. So option number D is the right answer, which is external occipital protuberance, which is present in the behind occipital bone, that gives some outer part, or you can say you can feel it. So these are the 10 MCQ on radiography. I hope you clear out all the points. So that's all for this video. Thanks for watching.